Good afternoon, everyone. This is Mike Gatorna with Health Agents Network in collaboration with Bankers Fidelity. And today we're going to talk about marketing Medicare supplements, common and easy ways to get your message to prospects. Before we get started, though, I want to thank you all for attending. I also want to let you know that if you have any questions, comments, concerns, threats, or promises, feel free in the user panel in the question area to write those in there, and we'll address them as we go along. So if you have a better idea, a different idea, a question on a marketing method, please share. And of course, afterwards, you can always go to Bankers Fidelity's online training platform and seek guidance there. But we are going to cover some common marketing campaigns done by Medicare agents in the field. That would be door-to-door, cold calling, client referrals, professional referrals, and seminars. So the platform is we're going to just talk about the pros and cons of each, and then we'll give some tips on how to make those effective. And it's really important before we get started to choose marketing campaigns that you're really going to put your effort into. Give you an example. When I was a full-time agent in the field, I was not big on cold calling. I was very distracted. I'd call a couple people, I'd open my email, go to YouTube, watch funny cat videos. I was easily distracted. Not only distracted, but unmotivated. So I had no desire to go ahead and pick up the phone and start dialing. So my time was wasted. I was much better door-to-door. I prefer to do that. So I took less time cold calling and spent more time door-to-door. And you have to find that mix for yourself. So let's look at some pros and cons of each one. Well, again, I am partial to door-to-door. Marketing is low cost. You just need a list of people to go see and some time. And you can go start knocking on doors and telling people you're there to help them. People tend to be more receptive, too, when you're in person. On the phone, it's easy to hang up or dismiss somebody. But when you're in person, people tend to be more courteous and polite because you're right there and you're a real person looking at them. It's also easy to do in between appointments. So you have an appointment at 9 o'clock across town, and then your next appointment's not till 1 o'clock. Let's say the first appointment took an hour, so now you have between 10 and 1 o'clock to kill some time. Start going door to door, and maybe you pick up appointments in between, maybe set some appointments for the following day or later that afternoon. But rather than sit in a parking lot or wander around the store or something unproductive, you could help feed that pipeline of prospects. Now, of course, the cons are it's very time consuming. Going door to door can be pretty time, it could take a long time, especially if the homes are spread out. It's also weather permitting. This is no fun to do in a monsoon or snowstorm or a lot of rain. So if it's adverse weather, on one side, it stinks to run up and down driveways and get all sopping wet. But the other side, just to kind of offset that is, there's a good chance that seniors will be home if the weather's adverse. So take that as you will. And then urban versus rural. Obviously, urban is much easier because the homes are on top of each other. When you go rural and the homes are 2, 3, 4 miles apart, door-to-door is not really a productive way to spend your time in most cases. So some tips I picked up along the way going door-to-door, use a clipboard. It gives you a flat surface to write notes on in case they want to have a conversation at the doorway. Also, I bought the kind that opens up and has a compartment inside. That way I had a place to put my business cards, extra pen, any flyers I was using, and it gave me a little storage spot. Plus, it also makes you look official when you have a clipboard. I also use a lanyard with my name tag so people had an idea of who I was. Now, mind you, for my name tag, I just went to Microsoft Word, took a picture of myself, put it on there, put my name, my licensed agent, and put that inside the lanyard. So it wasn't an official name tag, if you would, but it was still a valid name tag. Also, branding. If you have any shirts for your agency name or some Bankers Fidelity apparel, definitely wear that in the field so it makes you look more official. Now, cold calling. Cold calling has gained a lot of steam over the past couple of years for insurance agents because more people are more receptive over the phone now, not so much face-to-face with online technology, but also technology for cold calling has picked up as well. So this is also relatively low cost. Using a phone, people to call, and you could go. Opportunity to mass market. You could get an auto dialer, which will have maybe 3, 4, 5 lines going at once. So rather than go to door and knock at one door at a time, think of this as knocking at 5 doors at a time every 20, 30 seconds. It also is easier to break into new locations and markets because you don't physically have to be there. So if you're in one part of the state and 8 hours away is in the other side of the state, you could do that relatively easy by just getting the list, the information of those people out there and start calling them. Now, of course, the cons is lots of rejection. Unlike door-to-door where people are more receptive in face-to-face situations, it's real easy to hang up on you. So you have a lot more rejection than you would going door-to-door. DNC list has really cut down the opportunity to call people. On average, what we've seen, if you get a list from a lead vendor of 1,000 names and ask for phone numbers, roughly 12% will have phone numbers. So of 1,000 names, you have about 120 people to call, give or take. And of course, burnout. And this is near and dear to my heart because it happened to me, but I got sick of picking up the phone and calling or sitting there and calling and having that same conversation with no one in front of me. I always liked the, if you would, belly-to-belly selling where I'm looking at the person rather than just talking to them over the phone. However, I have friends who are selling over the phone having great success. So of course, it's all dependent on your personality. I tell you, don't read from a script. Of course, at first it's a little harder to do, but people want to have a nice, natural, flowing conversation. They don't want to talk to someone that sounds like a robot on the phone. Smiling is just a simple technique you could use when talking on the phone for the mere fact that they can hear it on the other side that you're excited to talk to them. And don't like it? You could always hire a telemarketer too to do that. You can't really hire someone to go door to door, but you can hire someone to make the calls for you and either do live transfers or give you their information to call back later. Now, client referrals, of course, this is key in the insurance market because there's little to no marketing costs. We did a study. We asked a bunch of agents, and we looked at their marketing techniques. And on average, to sit in front of a client, taking time and marketing costs in consideration, it costs on average $178 to get in front of a client between mail drops, cold calling, door-to-door, the time invested in that, $178 to sit in front of a client. So that $178 is basically wiped out because all the marketing costs are gone. They're calling you. The client approval of your service, meaning that they already have common ground with you, so that trust is already somewhat built already in because their name was given to you by a friend, and a higher closing ratio because, again, the trust is built. The cons? Not really any cons of getting a referral. It's pretty much golden unless you have something that can't help them, but hopefully that's already been determined because they're calling you for a specific reason. Now, some things to do on client referrals. If you're calling your book of business to touch base, don't just call to sell. It's a great way for people to stop answering your calls. Just call to check in so often. It's your job to be top of mind. There's a saying, I'm going to slaughter it here, but it's not the client's job to remember you. It's your job not to be forgotten. So don't just call to sell them something because then they're going to just think of you as a salesperson and not a trusted advisor. Drip campaigns, of course, you want to keep your message for your clients. This could be through a newsletter, through Facebook posts, through any type of social media that you have linked with your clients. Again, going back to newsletter, a lot of agents use an electronic and or paper newsletter just to keep their service and themselves top of mind with their clients. And last, be a resource. If they need help, they should be thinking of you as more than just an agent, but a trusted advisor. This is especially true if they get some sort of solicitation in the mail for other insurance. You want them to call you and say, hey, Mike, what is this I just got in the mail? Then you know that they are trusting you and you have their best interest in mind. So be more than just an agent, be a resource. Now, the other side of referrals are professional referrals. I think this is a missed opportunity for a lot of agents because as a pro, you have more services to offer to your clients. For tax season, which is past us, you can talk to your clients about do they have a good CPA or good tax person to make sure they're maximizing on their returns. It can be low-cost marketing. It's just a matter of passing out a name and phone number and getting connected in the community like that. And the level of trust I've already built in. When you get a referral from some other professional, that there's some weight. Maybe not as much as a client referral, but there's still a level of trust saying, I trust this person, so by default, I'm going to give you some of that trust as well. Now, the cons, of course, is it can take some time to get established with another professional. They want to make sure that you have their best client's interest in mind and vice versa. The other side of that is your reputation is on the line. So if you're doing business with someone and their reputation falters, or maybe their reputation isn't as stellar as they seemed it was, you could be associated like that as well. So, people do associate you with the people you spend time with, and if that person ends up being untrustworthy, they may associate you as untrustworthy as well. So to get these professional referrals, make it reciprocal. Don't just expect leads from them and not return any. Keeping in touch with them, just like you do with your clients, you want to keep in touch with your professionals. And the next question I get all the time from agents is, well, where do I find these professionals to hook up with or to network with? And you can do it at very low cost, very easy way to do it is LinkedIn. Just search in your area and you can find all kinds of other professionals. One key market for Medicare specialists, such as everyone on this call, is that most P&C agents, or I should say a lot of P&C agents, don't want to touch Medicare. They're more interested in maybe commercial liability or commercial insurance or auto and home insurance, not necessarily the Medicare market. So team up with them so when their clients have questions about Medicare, they can turn them over to you as well. All right, seminars. This is another form of marketing I did a lot in the field because you could see numerous prospects at one time, and it could either be your current clients to do updates or maybe just Medicare refreshers every so often, and you can invite your clients to bring their friends as a soft introduction to you. And also, you can be seen as a local area expert. We have that challenge, and I hate to bash on used car salesmen because I have some friends that sell cars, but they have that stigma about them of being, shysters, if you would. And unfortunately, sometimes insurance agents share that same limelight, unfortunately. Well, the people that want to do business wrong are not the ones that are putting themselves out there. So if you're out there in front of mass markets or lots of people or doing seminars, people are going to associate you with an expert that's not afraid to get in the limelight and get into the light of the community. So definitely it doesn't hurt to do seminars. Now the con is could be low attendance. I've done seminars with one person showing up. I've done seminars where nobody shows up. But you still keep doing them because you know what? Over time, you will build some steam. It can be time consuming depending on what you're presenting, depending on the setup, how far out you're doing it. So it's always a concern. And it may be expensive depending on the seminar. If you're doing a file expense seminar and offering lunch, you may have 20 people show up at $10 a head for lunch. That's a $200 seminar, which isn't bad, but you also may have a room fee and other fees associated with it as well. So just watch those costs. Now, to have a really effective seminar, you want to make it interactive and involve the audience. Have a dialogue, not a monologue. So you don't want to show up and just be bloviating about the subject with no interaction. I realize I'm breaking that rule right now, but it's a little harder to have the interaction online. Obviously, in person, it's much easier to point to people, to see their facial reactions, their body language to what you're discussing. Don't just read the PowerPoint. If you're using a PowerPoint, make sure you have nice graphics. The one here you're looking at right now, hopefully you are finding somewhat appealing because I built it, a little partial to it, of course, but it's not just words on the screen. People have pictures to process, and they process pictures much more effectively than they do words. And pens and paper. Give them pens and paper so they can write their questions down or take notes. Don't just have them sit in an empty spot. It's also a great way to show them where to sit. Most people will sit where something is. So if you have a pen and a pad of paper at 15 chairs and there's 20 in the room, there's a good chance they'll sit at the 15 chairs, not the other 5. So what to do with all this information? Good question. Well, what you could do is decide how do you want to market. If you hate the phone, don't pick it up. Find other ways to use your time more effectively. And don't be afraid to try something and realize it's not for you and switch gears. That's part of the process. We don't know what we're going to like until we actually try it. Just like when you're a kid, your mom or dad makes you try food because if you don't taste it, you don't know if you like it or not. Set times for marketing. If you're having a hard time building a prospect pool or prospect pipeline, whichever terminology you prefer to use, set some time and make calls. I'll tell you this worked for me. So from myself, my own experience, I had to force myself every Monday. All I did was reach out to my book of business, knock on doors, and set up seminar times. But my days Monday was my prospecting days, and then hopefully the rest of the week I would have appointments and or activity to sustain the rest of my week. So if you're having a hard time, set hard hours. Say from 10 to 12 on Monday morning, I'm going to just call. I'm just going to call my book of business. I'm going to cold call people. And then from 12 to 4, I'm going to go out there and knock on some doors. So you have set time. It's easier to focus when you have these hard times set. And then, of course, perform it. Don't just say you're going to call from 10 to 12, call 3 people, and then start checking your email or watching videos online. Turn off the internet. Get rid of all those distractions and just start dialing for dollars, as they say. And then track your results. This is key. I think a lot of agents really slip on this, and it's unfortunate because how do you know what's working and what isn't? What's your best return on investment? You may be surprised. You may set more appointments one way but less sales, as opposed to setting less appointments but having more sales another way. So track how many appointments you set up that marketing campaign. Track how many sales you get. Track the costs, because obviously doing a mail drop is much more expensive than going door to door. But if you're more profitable with the mail drop, then you want to continue to do that. The number of appointments might not be there, but the profitability may. So don't be afraid to go that route. So hopefully you got some good information on this. Watch for additional emails and training opportunities. We are going to start doing these monthly through Health Agents Network in collaboration with Bankers Fidelity and their Bankers Online Training, or BOLT. Now, we try and keep these about 15, 20 minutes long, so you're not taking on the field very long. And there are recordings available on Bankers Online Training in case you missed it and like a refresher, or share it with your other agents. So again, if you have questions, comments, concerns, threats, or promises, check out Bankers Online Training or visit healthagentsnetwork.com for more information. So thank you very much. Go out there, have fun, make money, and give impeccable service.